Well, good morning. Thank you for joining us for this conversation today. We had close to 300 registered, so we know this is an important topic here in our community. The Women's Commission, just wanted to kind of brief us here. It's comprised of 18 commissioners who are appointed by the mayor, individuals who in our community who are passionate, who are advocates, and who give their time and their expertise to advise the mayor and his administration on best ways to impact change for women in our community. The Commission's work is to raise awareness and drive policy change in our community to improve the women's economic vitality. We work in 4 main areas: gender equity in the workplace, evictions and housing, health, and childcare. We also developed the Columbus Commitment, Achieving Pay Equity. It's a pledge to bring Columbus employers to the front lines of change. While there are no simple solutions to closing the gender and race-based pay gap, it's clear that intentionality and investing in women strengthens the economic backbone of our community. The Columbus Commitment is a voluntary, employer-led pledge which asks employers to commit to learning about the gender pay gap, including understanding how race and other factors create larger disparities, analyzing and reviewing compensation practices and internal policies, and 3, taking action to invest time and talent to address gender and race-based wage disparity by implementing solutions. We are excited to share over 280 local employers have signed the Columbus Commitment. And following this webinar, you'll receive an email with more information about the commitment and how to find out if your employer has joined. If your organization has not signed the pledge, we encourage you to share the Columbus Commitment packet with your CEO, your HR team, and your senior leadership. And of course, you can always reach out to us with any questions. So again, thank you for joining our conversation today. The COVID-19 pandemic is a public health crisis that has impacted each one of us in different ways. We each have had our own unique experience, and we also know that through research, through listening to our neighbors, our clients, and our community, the pandemic has had a much greater impact on women and families. The pandemic has also caused an economic crisis that has laid bare existing racial and gender inequities. And today, our panelists, we will examine how the pandemic has impacted women in our community. So I'm pleased to introduce today's panelists. We have Elise Shaw. She is joining us from the Institute for Women's Policy Research, where she serves as study director. As a national think tank, IWPR builds evidence to shape policies that grow women's power and influence, close inequality gaps, and improve the economic well-being of families. Next, we'll be joined by Christy Angel, President and CEO of the YWCA Columbus. YWCA Columbus is an invaluable partner committed to the work of eliminating racism and empowering women. Christy is an inaugural commissioner with the Women's Commission, and she's steadfast in her commitment to women in Central Ohio in advancing racial and social justice. And finally, we'll be joined this morning by Commander Kelly Weiner. This morning, Police Chief Elaine Bryant had an emergency, some things happening in our community that she needs to pay attention to. So we hopefully will have a chance to engage with Chief Bryant at a later time. But this morning, thank you so much, Commander Weiner, for being with us in this conversation. We know here in our community, with our relations with the police, your dedication to rebuilding trust with the community, centering racial equity, and reimagining public safety is at the forefront of you and your team. So we're proud to partner with you and your department in creating change. Today's format will include hearing from each of our panelists. At the end of the remarks, we'll move into a time of discussion and question and answer for the final 20 minutes together. Please submit your questions and comments in the chat. We'll be monitoring the chat throughout the session. We may not be able to get to every question, but we will do our best. Again, thank you for being with us this morning as we work through some of the tech issues. And with that, I am going to turn it over to Elise.
Hi, thank you so much for that introduction, and thank you so much for having me today. I believe that you all will be sharing my presentation, but let me know if you need me to share my screen. There we go. Wonderful. Yeah, so thank you so much for having me talk about this vitally important topic. Next slide. So we already heard a little bit about IWPR, so I won't belabor this, but IWPR is a DC-based think tank. We were founded in 1987, and we use both qualitative and quantitative analysis of public policy through a gendered lens. We look at both gender and racial equity as a policy initiative. Next slide. First, I think it's vitally important to set the stage. So we're talking about what's going on for women in the workforce now with the pandemic, but the crisis we are seeing now is not new. The pandemic only highlighted and exacerbated existing inequalities and really negatively impacted those who are already struggling the most. This data that I'm about to present really sets the stage for showing the inequalities that women and women of color faced before the pandemic even hit. Next slide. So first we'll start with the wage gap. Let's see, next slide. So if we look at this graph, you can see that the progress on closing the wage gap between women and men, and this is women and men who work full-time year-round, so it does not include part-time workers. The wage gap would be even wider if we include part-time workers. So according to our research, if the pace of change continues the way it is, it will take 40 years for women to reach pay equity, and that's all women. So currently the wage gap in the United States is about 81.5 cents. So that means women earn 81.5 cents for every dollar a man earns on average. This is not the same for all women, as you can see here. So if you look at Black and Hispanic women, they earn significantly less on average. Black women earn 62 cents for every dollar a man earns, and they're projected to close the wage gap in 2133. Latinas, even longer. They earn 55.4 cents for every dollar earned by a white man, which is a huge gap, and are projected to close the wage gap in 2220, a wait of almost 200 years. Next slide. If we look at the wage gap for what's going on for women in Ohio specifically, the wage gap is actually slightly larger for women in Ohio compared with the nation overall. Women in Ohio earn 87.4 cents for every dollar a white man earns. But Black and Hispanic women, Latinos, earn even less. The disparities here is about almost $20,000 less a year, which is 64 cents for Black women and 62.4 cents for Latinas. This is a huge gap for women in Ohio specifically. So when we're talking, next slide, when we're talking about the wage gap, we think about, these are averages. What goes into the wage gap? There are many factors that go into, the wage gap, but one of the biggest factors that we're seeing play out with this pandemic is what we call occupational segregation. What does that mean? Well, women are more likely to work in industries and jobs that are dominated by women. And a lot of these jobs are low wage jobs. So think about education and care of children, care of the elderly and sick or disabled individuals. This is work that is traditionally done by women at home, and when it's paid in the economy, it's often valued less. As you can see here, the share of women in low-wage female-dominated occupations is about 81%, which is huge when you compare the share of women in all other categories. So this this low-wage work is almost exclusively done by women. They wake up. In addition to care jobs, these jobs include, maids and housekeepers, beauty and personal service workers, cashiers, and food preparation service workers. So it's a huge, huge category in this low-wage female-dominated occupation category. Many of these jobs are low paid, even though workers are expected to have either a high school diploma or some post-secondary credentials, even for a lot of these childcare positions. What does this mean? So it means that twice as many women as men work in low-paying occupations and are more likely to live in poverty. Why does this matter? Next slide. Women's earnings are no longer optional. They are central to family and women's economic security. So when we look at what we call breadwinner mothers, which is what this slide shows, we define a breadwinner mother as a woman who earns at least 40% of the household income. This means these earnings of these mothers are central to the economic security and well-being of themselves, their families, and their children. At the same time, these women are also spending 37% more time on unpaid household and care work, in addition to being breadwinner mothers. So if you look at this breakdown by race and ethnicity too, you can see that this varies greatly depending on race and ethnicity. A staggering 4 out of 5 Black mothers and 2 in 3 Native mothers are breadwinners, the vast majority of these being single mothers raising families of their own. Overall in the United States, half of families have a breadwinner mother. This trend is also true for Ohio. Slightly more than half of all mothers are breadwinners at 55%, and 57% of Latinas are breadwinner mothers in Ohio, and 84.4% of Black mothers in Ohio are breadwinners. Next slide. So when you combine breadwinner mothers and being more likely to be in low-wage work, poverty among women was on the rise. Women are 30% more than men to live in poverty. Native American and Black women are twice as likely to be in poverty as white women. And this means that about 1 in 4 Native American and Black women live in poverty. This has a major impact on family economic security. So let me just remind you too, this is all pre-pandemic data. So before the pandemic even hit, you have all these inequalities. When you look at the poverty rate among working women in Ohio, right now it's about 10.3% of women, working women, live in poverty. For single mothers, this is a staggering 33.6%. So there's a huge amount of poverty among working women, both nationally and in Ohio. Next slide. So all of these factors, all these pre-pandemic inequalities created kind of this perfect storm for the pandemic's she-cession. Next slide. IWPR has been tracking the monthly jobs numbers, and as this graph shows, so this graph is all of these numbers are comparing the number of employed women and men compared to February 2020, before the pandemic recession hit. And as you can see, all of these numbers below the line are all the job, what does it look like compared to February 2020? As you can see here, it's not been equal. Women were hit especially hard at the beginning of the pandemic and have been slower to gain back those jobs. This has a lot to do with the fact that women were concentrated in the jobs that were impacted most by the pandemic economic recession. So think childcare, retail, wait staff at restaurants. All of these jobs are also slow to gain back the momentum for full employment. And so we're seeing this continued impact on women in our economy. Next slide. So, you go back one. Black and Latina women have been hit particularly hard. This is, again, national data. There's not a lot of state-specific data on a lot of this data. This is BLS data that is put out every month, and state-specific data is much harder to come by. It's a longer lag time, so we're waiting for it to be released. But as you can see here, Black and Latina women have been hit particularly hard. The unemployment numbers show that their continued high levels of unemployment, which is still significantly higher than pre-recession levels. As jobs come back, they're not coming back at the same rate for all people. And so you can see that we have these negative numbers that above the bar graphs. That's how much there has been a decrease over a month in unemployment. So it shows us that the unemployment numbers nationally for all people are falling, for all women. But we dug a little bit deeper into these data, and we found that this is actually not necessarily all because people are going back to work. Partly, it reflects the fact that women are dropping out of the labor force altogether. In order to be considered unemployed in our data set, you have to be actively looking for a job. So if you decide that you've been long-term unemployed and you give up, you've dropped out of the labor force, the unemployment rate will go down, but that doesn't necessarily mean that women are gaining their jobs back. This is particularly true for Black and Latina women. Their labor force participation rates have fallen by 65,000 and 51,000. So this means that while some are getting their jobs back, some are just dropping out of the labor force altogether. And we're seeing this with women overall. So while unemployment is going down, which looks great overall, we're actually seeing this mass flock of women who are just dropping out of the labor force altogether. Next slide. So just to kind of look at what are the jobs, again, that are still struggling. As we can see here, the jobs that are slowest to gain back to their pre-recession numbers are in leisure and hospitality, education and health services, and government. These are all areas that are dominated by women. So the jobs you can see here for women are especially lagging in these areas. We're really seeing that women are just struggling to get back into the labor force. Why is this? There are a lot of reasons, but next slide. One of the areas we've been particularly interested in is childcare. So when we think about childcare, we know that it's an essential service that keeps women, specifically women, because unpaid childcare is usually borne on the shoulders of women. It helps them stay in the labor force. So women need childcare. The unfortunate thing is, with all the childcare center closings, we're seeing this lag in recovery of childcare jobs. So if you see the childcare jobs here are not trending with the overall job recovery here. The slow recovery of childcare sector is especially poignant for women because they're much more likely to be the primary caregivers. And if you cannot find childcare, you cannot go back to work. So the childcare job lag is impacting not only those who are employed in the childcare sector, which is more likely to be women, but is also impacting everyone else who has a child. Next slide. So this was just kind of a brief overview of some national data. We have a little bit of Ohio-specific data, but really what's going on for women when we're looking at the impact of the recession. Where do we go from here? Next slide. We think this is an opportunity to not just build back, but build back better. At IOPR, we have been advocating for a few really central components of what would help more women get back into the job force. Rebuilding the social safety net to invest in programs like unemployment insurance, TANF, SNAP, supplementary security income, SSI for Social Security, expanding the EITC and other programs for workers and vulnerable families would help fill these gaps while families are still struggling. We also need to establish a national childcare system that not only provides quality childcare for every household regardless of income, but also has pay increase for childcare workers so we can restaff and really lift up this childcare sector as an essential service that is needed for people to get back to work. We also need to make sure that the jobs that are created are high quality jobs. So we need to have increasing the minimum wage as a priority at both the state and national level. We need paid sick and family and medical leave, and we need to create employer-sponsored care subsidy programs where possible. We really need just to get people back into jobs that really work for them and allow them to have the economic security they deserve. We also really need to look at collective bargaining. We know from our other research that states that have collective bargaining and rights for workers are where all workers tend to thrive. The so-called kind of where unions are undermined in those states, the so-called right-to-work states, we see depressed wages for all workers across the board, not just union workers. So unions really, really, really help boost wages and really provide a lot of economic security and benefits for all workers. And then increase the investments to businesses owned by women and women of color. This includes providing resources and technical assistance to help identify funding opportunities for these businesses. Especially in this economy right now, people really need to have that flexibility to be able to establish their entrepreneurial endeavor and not have to worry about putting food on their table at the same time. So that's all I have. I know it was a lot really fast. I believe they're going to provide the slides afterwards, but I would be happy to take any questions as well at the end.
Thank you so much, Elise. We're having just a little bit of issue with our bandwidth. So if folks don't mind, if you're not a presenter, if you wouldn't mind just turning your camera off. And we will take questions at the end. So I am going to pass it now to Christy Angel. Thank you.
Thank you, Christina. I hope everyone can hear me. WebEx does not like me. I always start by saying that, and sometimes I have to try to navigate around the issues. So I hope everyone can hear me. Thank you so much to the Women's Commission for giving me an opportunity to present on the panel. While I don't have a PowerPoint, I want to first start by saying I'm going to just share something with you because I think it really will kind of set the stage for a little bit of what I'm going to talk about. Recently, some of our team members asked me what my equity statement was. And, you know, I started to really think about that because I've never thought about my own personal equity statement. But as I thought about it, I thought about, equity to me is it's a process. It's a constant state of, change or trying to effect change in policies, in programs, in procedures that are set up for, for some people to be successful or to have what they need to live their best healthy lives, and for others not to. Whether it's not that it was intentional, but that's just how the systems were set up, and that, I find that probably in my entire career I've spent trying to infuse equity in various sectors, changes, our policies, programs, et cetera, to create a better balance or bring balance into the lives of those who really have suffered from imbalance. And so when I think about equity in this particular conversation, if you go back to, and we're not going to be able to go back to the slides that were just presented, we have lacked equity in areas where women disproportionately, where we work, where we, the jobs that we hold, and in the programs and the policies that, kind of lift up those efforts. So take childcare, for example. Childcare, after-school care, before-school care, highly needed for families and disproportionately breadwinner mothers, breadwinner women, to live their best healthy lives and be successful, be it go to work, go to school, what have you. And yet, childcare is a highly regulated industry with a business model that doesn't quite work. And if you just think back to the pandemic, how long it took, let's take the state of Ohio, how long it took to get to child care, whether child care was going to stay open, was it going to shut down, how are we keeping those employees safe, how was the, what was the regulatory relief, what were the regulatory reliefs that child care providers were going to get, all of those things, like how long it took to just get to that. And in our advocacy at YWCA Columbus, we spent so much time just trying to talk to the business advocates in the governor's office and the Job and Family Services about the business of child care, and we needed to get to the table to figure out what can be done to keep frontline workers working and provide them some access to child care so that they could continue to do the jobs that we needed to done during the first part of the pandemic. And also, you know, what we needed to keep them safe. And yet, we couldn't get traction, and we were one of the last sectors really to get any attention. And I say all that to say that when I think about equity, there was no equity in that process. And I always, you know, relate to, and John Barker is a friend, and John, if you're on this call, you know I love you. His advocacy on behalf of the restaurant industry was so strong, and you saw John in front of the news all the time. And I kept saying, our sector needs a John Barker. We need to have the same kind of influence, the same kind of access as the restaurant industry. And when I say our sector, I mean the child care sector. So now let's fast forward to child care providers were given the opportunity to have a pandemic license. Some could operate still with huge regulations, you know, kind of set down on top of those licensures. No child care business really was able to make money, if you will, in that time. So any business owner, child care business owners disproportionately are women. In-home child care workers disproportionately in Ohio in particular are Black and brown women. Your ratios were so low that you weren't going to make money. But the issue was just provide the service. And so we all go through adjusting our businesses, PPE, you know, ratios that are very low, keeping employees safe, having to have additional employees on staff when you have to go into a quarantine situation, all of the things that you have to keep changing your business model to address and to address the pandemic, but also to make sure that you can keep kiddos safe and keep families working. And then we start to come out of, you know, at least what I call it phase one of the pandemic, when we get to vaccination stage. And of course, kiddos still yet can't be vaccinated. Schools want to be open. Families, adults are going back to work, and we now have to adjust the business model again. And business owners are forced with the decision of what kind of ratios do I have? How many kiddos can I have? How many staff can I hire quickly? Because now I have to get back up to speed. And the workforce isn't there. Because the workforce has made a decision. Some people are, I don't want to come back to this low-wage job that is challenging in the pandemic and keeps me, you know, in a mask or puts me, you know, my health in a disproportionate kind of, puts me disproportionately in an unhealthy situation. And so we operate child care, we operate before and after school care in 3 school districts. We have been on the ground and been faced with trying to get employees to come back into the business at a time when you can go to work for Target for $16, $17, or $18 an hour, at a time when you can perhaps go work, you know, in another sector for more money than we were paying. And then, you know, so everyone says, well, pay more. Well, if you pay your child care workers more, and we do pay our child care workers probably better than most in the marketplace right now, as we've all had to adjust, then you have to charge your customer more because your regulatory requirements don't end. And so now disproportionately we impact families and women again because now we say we have to raise your rates because we have to pay our employees more. And what I have learned through my work, and thank you, Matt Smidle, I saw you on the call, and I know that there are some of our other child care advocates on this call. What I have learned is that the regulatory requirements, make it impossible for a business owner or the business of child care to operate efficiently. And if this were an equitable situation, we would have, be it Rev 1, be it, and I'm not picking on any of these entities, but we would have someone studying this business and trying to figure out how to make this a more equitable business because it is the underpinning of our society. And it is the tool that gives people, the ability to go to work and know that their kiddos are safe and learning and healthy while they are working. And so, one of the compelling arguments that we have been, hearing from our providers in the recovery and resiliency work that Mayor Ginther, Council President Hardin, and County Commissioner John O'Grady set up was that the business of child care is broken, and that we need to have, those business innovators look at the business of child care and really say, let's figure out how to make the business model hum so that we can pay people more and we can keep rates at an affordable cost. And so that we don't lose people, in this child care, in the marketplace. We don't want to lose families while we are trying to, change the business of child care. And so one example of that, is, so I talked about the regulations, child care and providing insurance to your employees. If you're a child care provider, it's very difficult because insurance is very expensive, health insurance in particular, major medical. And so we've talked about, why don't we have a national model that puts child care workers into a pool and brings the cost of insurance, regardless of whether you're the YWCA or you are a private provider, brings the cost of insurance down so that our employees can have insurance, they can have days off, they can have all of those things. But at the same time, we can run our businesses in a way that we can pay them more. And I spend a lot of time right now talking about child care because it is the constant thing that people keep talking to us about, and it is the constant thing for us that is driving us to, hire more people, look for more workers in the workforce, et cetera. And I know we're going to talk more about this. We could talk a lot about housing, which is the other area where we spend a lot of time trying to infuse equity in. But at the end of the day, right now, to recover, we've got to recover from and rebound from this pandemic, we've got to start having a real conversation at the local level about what it's going to take and the prioritization of adequate child care and child care services and the business of child care in order to really bring the economy back. That's the starting point, as we see it. And I'll now turn the conversation back over to you, Christina.
Great, thank you. Thank you, Commander Weiner, for joining us today. I'm really excited about you being with us, so I'm going to turn it over to you now.
Okay, can you hear me?
Yes, loud and clear, thank you.
Great, thank you so much. Chief Bryant apologizes for not being able to participate today, but there have been a couple of things that have occurred that she needed to deal with today. So she asked me to convey a few points that she had been planning on discussing. One area that the COVID-19 has impacted has been domestic violence. COVID-19 has affected everyone, but women that are victims of domestic violence have found themselves somewhat isolated in shutdowns. We've also seen this with children being around mandatory reporters with schools being closed. So we haven't seen that these crimes have stopped. They just have been reduced being reported because of the isolation and the shutdowns. Based on a review of 12 U.S. studies, most of which included data from multiple cities, it shows that domestic violence incidents increased 8.1% after jurisdictions imposed pandemic-related lockdown orders. Columbus being one of those cities. We've seen consistent reports of domestic violence, and like I just spoke of, last year we saw a reduction in the reporting of the physical and sexual assault of children, and we do believe that those assaults didn't stop. They just were not being reported as much because of the shutdown. As far as human trafficking goes, with the shutdowns and the isolations, abusers have been able to target victims more, more spending time online, less time maybe getting away from an abuser or a trafficker, where you have an opportunity to reach out and ask for help. So we fear that our human trafficking victims have continued to be victimized. Balance that with Catch Court, which we are very involved in, and that is such a wonderful program, with courts being shut down and things being done by Zoom and not in person. We fear we haven't been able to help victims as much. And with shutdowns, loss of legitimate income because of the shutdowns, maybe some victims have been forced to participate in human trafficking activities in order to earn money. As far as unemployment, like I just spoke of, that women may have been forced to turn to alternate means of trying to earn money to support themselves and their children. I know Chief Bryant wanted to speak a little bit about recruiting. She has, since she's been here, she's been a huge advocate in focusing on recruiting diverse members of the Division of Police, women and minorities. And as she just expressed to me, it's not just an issue of getting folks in the door, but it's an issue of retaining people. We've seen higher number of retirements and resignations, which has forced us to increase overtime, which increases burnout, which then leads to people maybe deciding to retire, kind of a cyclical thing. And also for us in law enforcement as first responders, with the pandemic, we weren't able to shut down. There's things about law enforcement that might not be attractive to people wanting to do that job. And now, you have the concern of a global pandemic and always, having to be around other people. So the COVID-19 has added that into our difficulties of recruiting. And as mentioned earlier, women a lot of times are the primary caregivers. And when children weren't in school, a woman has to take care of her children, do the homeschooling. I think we all struggled with that over the last year and a half. And having a career where you can't work from home might not be ideal for some women, and therefore that's challenging in our recruiting efforts. But I can assure you that Chief Bryan is very committed to increasing our diversity in our recruiting, and she's got a lot of programs that she's been talking about. So that's pretty much all I have for right now, and I understand there will be a question and answer session, so I'd be happy to answer anything that I'm able to, or at least I can follow up with Chief Bryan.
All right. Thank you so much. We have a question for Elise. And Elise, Anna was curious if you could tell us a little bit about some of the trends you are seeing in advocating for paid time off for maternity, paternity leave, and primary caregiver leave. So maybe caregiving leave generally.
Yeah, that's a great question. Can everyone hear me? Okay, good. I think it's working. That's a great question. What we're seeing right now is actually the most momentum we've seen on this issue of paid leave for caregiving reasons. We're seeing this push. We've been seeing this push at the state level and even at the local level as much as possible to really push for job quality, which is, ensuring that people have the supports that they need to stay on the job, which includes being able to take time off to care for yourself, your family, your loved ones when they get sick. So, or when you have, a new child or anything like that. So it's really interesting to me to see the momentum that has been picked up around this. This has always kind of been seen as an individual issue, childcare. So you decide to have a child, you have to figure out how to make that happen so you can work. What we're seeing with the pandemic is it's not. This is a societal structural issue, and childcare is just as essential as any other work support to make sure that people can stay on the job. So we're really seeing this increase in support for and this really big push for paid leave at the national level and at state levels continually.
Great. Thank you. This next question is for Christy. So just thinking about the different seats that we are all at, what do you think someone can do in an organization? Maybe they're not a decision maker, but what can they do to improve conditions for women in the workplace and promote equity?
Wow. Well, that's a lot there. There's a lot there. I think first, we should always be looking at our internal, and we're doing this ourselves too. Let me start by saying, this is kind of a new thing for me. I do not want people to think that YWCA Columbus, YWCA's of Ohio, or our national organization, that we have it all figured out. We don't. We are, one of my team members, Michelle, she works on our education team. I love what she always says, we should be in a constant state of learning, and educating ourselves and be curious, and we are trying to be that organization. But then what I would say is examine your policies and look for areas that are where you see the inequity. So think about, whether it's paid time off, leave time, holidays, all of those kinds of things, examine your policies, examine, and I know a number of corporations are doing this now, they're examining positions where, men and women are both holding the position, and they're looking at the pay to make sure that the pay is equitable, across the position, and that, men are not being paid or hired in at a higher rate than women. Also look at your positions where, those positions may be the same. And, we've often heard the example of, I think it's, and Shannon can correct me here, or Shelley, maybe someone in a hotel that works, in housekeeping, and perhaps the person that is in maintenance, and there's some similarities. And that might not be the right example, but I'll use us as an example. We have a position called, at the downtown building, it's the front desk engagement team. And at the family center, it's security. And at the family center, disproportionately, there are men in that security role. And in the downtown building, there are men and women. So looking across those positions to make sure that they are paid equitably, because they really are doing the same things, right? And we're calling them different things, and making sure that we're not, hiring someone in because, oh, look at the security, at the family center is different than the security at the front desk in the downtown building. So it's those kinds of things that you can do, and you can start to do that right away using your HR team and so forth. And I will also say that it is also recognized that organizations that have various entry points, various job classifications, you might have various shifts, hourly plus salary, all of those things, you have to take those into account when you're thinking about equity. So, another example for us, we just started a third shift differential, because the people that work on third shift, right, that's different than working first or second shift. You come in at 10:30, 11 o'clock at night, you work until 6:30, 7 o'clock in the morning. So we gave a shift differential if you take that shift. Because again, we're looking at equity. You work here at a time, when there are very few people, and the resources aren't as abundant because the administrative team isn't here. And so, just the access is different. So there's a shift differential. So those are some things that you can start with right away in your organization. And then you start to move to, we have an internal equity committee that we have started this year under the direction of our Chief Mission Officer, Jillian Olinger. Shout out to, my colleague and my partner, who does a fabulous job thinking about equity, and infusing our mission in the entire organization. You will learn a lot from your employees. So, you know, starting an internal council is another way where you can start to really talk about and learn about where the inequities are, and then to create, you know, some new kind of equity goals, policies, et cetera. And we are moving then to equity plans for the leaders in our organizations. So every leader will have a plan, and then they will also be, it will be part of their performance evaluation.
Wonderful. I'd like the First Lady to be able to introduce herself, so I'll pass it to Shannon Ginther.
So there's nothing like a global pandemic and lots of people on WebEx to shut me down. So sorry about the technical difficulties. You know, I think one of the things that we're seeing overall is, you know, just a real understanding granularly of what we have to do moving forward to get our economy moving in the right direction. Childcare and obviously pay, which we've been talking about from the Women's Commission perspective now for many years. And then beyond that, I think from a company perspective, we often get this question, you know, from different companies, what can we do from where we sit? And one of the things that I would continue to encourage is looking very holistically at your paid time off policies, at your supports for women, and, you know, really considering if that's the best that you can do. I work for a global consulting firm, and one of the things that we do is a lot of research on women and families, and also people entering the workforce. And the younger generations, this is an expectation for them to have a work-life balance, for women to be able to have, excuse me, a family and a life, and paid time off to support young families, because it's a challenge. And younger generations are making the decision, and we're seeing this play out in the workforce right now, that if they can't balance it, they just take themselves out of the workforce. And I don't think that's the answer, right? The answer is actually not that we just support a whole group of folks taking themselves out of the workforce. It's that we as individuals and companies, take a better look or a fresh look at the benefits that we're offering to actually support women and families being in the workforce. And I think the other thing I would say, one of the other slides that really struck me today, in addition to the childcare slide, which Christy talked a lot about, was women, you know, the wage, how many women are the breadwinners in their families. And so if they are taking themselves out of the workforce, we will continue to have not only a workforce shortage, but also an increasingly growing problem with poverty, which none of us supports. And so I think there are ways that we can challenge ourselves individually and as teams to look at these issues, and, to use Christy's words, have a real conversation in this community, not only about what the problem is, but what we collectively are going to do to solve it. Are there any last minute questions? I think we maybe have time for one more, Christina, before we sign off.
Yes, absolutely. So this one is for Commander Weiner. Given your position, where do you feel you have the greatest opportunity to make change?
Thank you for that question. And I can only speak for myself on this, not Chief Bryant. I think by nature of the rank that I have achieved, as of right now, I'm the only female commander in the division. I was actually the 4th female commander in the history of the Division of Police. I was promoted in 2010, and that's kind of crazy to think that I was only the 4th. But I think by continuing to do the best job that I can do, and to get an opportunity to participate in events such as this, I can keep trying to fight for change and put myself out there do the best that I can do, and live with integrity and try to be an advocate for ensuring that the Division of Police serves the community and that we accurately represent the community. So I just think I need to keep fighting, keep trudging along, and I think under Chief Bryant's leadership, we're on a very good path. Thank you.
All right, great. We have one last question that we're going to direct to all of our presenters. So what in your industry has you the most excited or the most hopeful for moving this work forward?
I can start. I believe in the power of collective change. So you just heard the commander say, you know, she'll continue to fight on her own. And though this community is ready for change and has shown over and over and over that we can tackle hard problems, and this is no different, right? So I think it's the time is now, and more so than ever, we have the data to back us up, right? That this absolutely has to change. And we know some of the root causes. So we know what the problem is, what it looks like. That's the positive to me. It's not a question mark anymore, and it's undeniable. And so then the challenge becomes, how do we most effectively and swiftly address the challenge? What do you think, Christy? Christy, we did not hear you. I must have given you my WebEx problems.
WebEx. I was going to say, you know, the pandemic, I'll say our sector. So I'll, you know, talk about the human services sector in particular. You know, brought us together and required us to work together like never before. And, you know, that has been a good thing because we have problem solved together. We have, you know, leaned on one another. And I think that that's really going to be, it's creating a different path, a different way that we work together. And then I also will say, in particular, you know, for the Black community in Columbus, Stephanie Hightower got us together quickly as the pandemic was starting to rage, and we started to share information, communicate in a different way, and we also started to look at more deeply at the inequities, and we are starting to do some data mining and agenda setting for Black Columbus, not just in the human service sector, but really trying to look in totality of, you know, what does our community need to live our best lives. And I think that advocacy and that agenda setting, you know, that's coming out of, you know, really Stephanie's idea is going to change our community probably for the future and for the better.
I can go next. I think that one of the things that I find most uplifting at this moment is I've worked at IWPR for 9 years now, working on these issues, collecting data, presenting it, and I've never seen the conversation around these issues get more attention and more input from different people than now. I think that we're seeing, again, this tidal wave of change where I think people recognize that now is the moment to make changes, to make drastic and significant changes that could really better all women, and really being intentional about how to do that. So I think that for me, that's really uplifting. As somebody who's been working in this space for so many years, it's really great to see the attention and the conversations that are happening.
I couldn't agree more with what all three of you have said, and the collectively working together, the upside, or one of the upsides of the pandemic, is how we've all had to pull together and rely on each other. So while I continue to fight myself, I do completely agree that it's something that we all need to fight together. And as far as me here at Columbus Division of Police, very excited with the leadership team of Chief Bryant and Chief Potts. So I think that they've been here about 3 months. So I think we've got some great strides to make. And I think that they're really going to help lead this fight. So thank you.
Well, I know we're at time, just a moment over. Thank you so much for joining us today. To all of our panelists, to all of you, to the participants, with your great patience for our technical difficulties this morning. We will release this recording and of course this slide deck, and also look forward to our next learning session in November of this year. Thanks and have a great day.